All right, everyone, we are going to get started. So welcome to the HMIS and COVID-19 webinar. All right, so as I said, welcome. Thanks for making time to be here today. All HMIS users with emergency shelter or street outreach programs were encouraged to attend this webinar, and all HMIS administrators with those program types are required to be here in order to maintain their HMIS license. We take this training very seriously because we want you to receive all of the crucial information and guidance that's been put forth by HUD and the CDC regarding COVID-19. We know that there's a lot of information out there, so we just wanted to provide you with the most up-to-date information that we can so that we can all stay safe and healthy during these difficult times. We know how busy you are, especially now. We know your jobs are normally very incredibly challenging, and I'm sure they are even more so at the moment during this pandemic, so we appreciate you taking the time to be here. The only housekeeping item we have is just reminding everyone that if you don't see your name on that participants or attendees list on the right corner, on the right-hand side of the screen, that you should make sure that we know that you are here. And there's also a way that you can change your name by clicking that little pod options drop down on the top right corner and then clicking edit my info. So we'll know that you were here. Okay, as usual, if you have any questions throughout the training, feel free to type them into the chat box, which I actually don't see right now. We're going to get that chat box up for you. And we'll answer those as soon as we possibly can, and we're also going to leave some time at the end for a Q&A. So while we're getting that set up, I'll take a moment to introduce everyone's presenters. We have Victoria Lopez, THN's Data and Policy Analyst, Antonio, THN's Database Coordinator, myself, Lindsay LaGrange, THN's Training Coordinator, and we'll be briefly joined by Marissa Ortega, THN's Coordinated Entry Data Specialist. We're all members of the THN Data Team, so if you have any questions or comments about this training, you probably already know that we can be reached at hmis@thn.org. Moving right along, today's agenda, we're going to cover a number of things. First, I'm going to just briefly talk about COVID-19 and some of the basics of the virus. If you haven't already, I highly recommend that you watch the COVID-19 guidance and support video that we sent out on March 27th. We emailed everyone a lot of COVID resources, and it's about a 30-minute long video that's really helpful. It dives really deep into all of that guidance that the CDC released. That guidance is about a month old now, which is crazy, so there have been a few changes in the last month as scientists have learned more about the virus. So we're going to cover those changes in today's webinar. We're also going to walk through some updated guidance from the CDC regarding emergency shelter staff and client considerations. And then we're going to walk through the CDC guidance for street outreach staff and clients. From there, we will head to HMIS, and Victoria is going to do a quick walkthrough of the COVID-19 assessment tool. There's been a few changes to that as well, so we're going to look at those updates. And then Victoria is going to just talk to us about why this tool is so important to use and how it can help us through this pandemic. Antonio is then going to take over and lead us through a discussion about resources in your communities. And finally, Victoria is going to finish up with just a little bit about the ROI, the release of information, and how we can approach that during a pandemic like this, where we really shouldn't be, in the same room as each other. So, moving right along. COVID-19 is a respiratory disease, as we probably all know, caused by the newly identified coronavirus. It's been detected throughout the world. Community spread of COVID-19 has been identified in Texas. As of yesterday, I didn't have a chance to update these numbers, but as of yesterday, there were over 26,000 positive COVID-19 cases in Texas and 690 deaths in Texas. It's important to note that the number of cases in Texas is probably much higher than the number who've been tested, as data shows us that a large number of positive people are asymptomatic, meaning that they don't show any signs or symptoms of having the disease, but they are still very contagious and are potentially passing that on to other people. Symptoms tend to show up in people 2 to 14 days of exposure to the virus. the main 3 symptoms of coronavirus patients are fever, dry cough, and shortness of breath. However, I think last week or earlier this week, the CDC officially released 6 more symptoms that we can attribute to coronavirus. So those 6 new symptoms are chills, repeated shaking with chills, muscle pain, headache, sore throat, and new loss of taste or smell. A majority of these cases will clear up on their own with only mild symptoms, usually within 7 days, but a number of cases can become severe and deadly. We're going to talk about those severe symptoms in just a minute. So as we know, COVID-19 is a virus, so that means it can only make more of itself by entering a living cell. According to the CDC, it's thought that the main way it's spread is person to person, so people who are in close contact with one another, about 6 feet, and it's spread through respiratory droplets that are produced when an infected person coughs or sneezes. So those contagious droplets of mucus or saliva from the infected person can enter our mouths, nose, eyes, and infect us. And an interesting fact, sneeze clouds can travel that contagious mucus and saliva up to 200 times faster than it normally would, which is kind of scary. And also, there have been a few instances of COVID-19 found in fecal matter of infected individuals. It's possible that a person can get COVID-19 by touching a surface or object that has the virus on it, and then touching their own mouth, nose, or possibly eyes, but this isn't thought to be the main way that the virus spreads, and we're currently unsure of how long the virus can survive on those surfaces. But once it enters our bodies, it ends up in our lungs, and in short, the virus convinces your healthy lung cells to destroy themselves, and it really puts our immune systems into overdrive. And there's currently no cure or vaccine for COVID-19, so the best way to avoid getting sick is to avoid being exposed. So we need to kind of create a social vaccine since there's not currently a vaccine, and that basically means not getting infected and not infecting others. So we're going to quickly walk through some of the best ways to limit the transmission of COVID-19. The first one is washing your hands. That may sound trivial, but it is probably the best thing that we can do to avoid an infection. Soap is a very powerful tool against COVID-19. The virus is basically encased in a layer of fat, and soap breaks apart that fat pretty easily, and it leaves it unable to infect us. So when washing your hands, make sure you wash all parts of your hands, under your fingernails, the backs of your hands, your wrists, and between your fingers. And one funny way that I've seen on the internet to think about it is to pretend that you just cut up a bunch of jalapenos and you have to put in your contacts now. So really scrub. The next thing we can do is social distance or physical distance. So we're talking about that 6-foot barrier between people. That means no hugs, no handshakes, and if possible, stay home to protect those in our society who don't have the privilege of being able to stay home, like doctors, cashiers, and many of our homeless service providers. Those folks who are not able to stay home are depending on the rest of us to not get sick and limit their chances of being infected. So that means limiting contacts with other humans as much as we can, and it also means if you have symptoms or feel sick that you really need to stay home, even if you are one of those essential employees. Number 5, we need to limit contact with high-touch surface areas, such as handrails, doorknobs, etc. And we need to clean these as often as we can. Number 6, we should cover our coughs and sneezes with a tissue or the crook of your elbow. If you accidentally sneeze into your hands, that's okay. You just need to go wash your hands immediately before you touch anything else. In our last video, we said that you should only wear a face mask if you have symptoms, but the CDC updated this actually a few days after we came out with that video to say that everyone should be wearing a cloth face mask if they are going within the vicinity of other people. This is largely in part due to the fact that so many of us are probably those asymptomatic carriers. So we may have no symptoms, and yet we could still be infecting people when we go to the grocery store or to work. There's no official mandate on these masks, meaning you won't be fined or ticketed for not wearing one, but it's a really small thing that we can do to try to protect ourselves and others from spreading this, especially when we're sometimes around some of our community's most vulnerable populations. And finally, clean and regularly disinfect. Again, soap or hand sanitizer are very powerful tools here, so use them often. Let's talk about some facility layout considerations. All of the following information that I'm presenting is from the CDC's website. It's in the section specifically for homeless service providers. I don't want to waste any of our time by repeating what we already covered in that last video, but there have been some changes to the guidance due to new information. So I'm going to briefly walk through the following information and cover any changes and all of the really important stuff. But if you did want to find any of this information after today, you can really just go Google CDC and then homeless, and it'll probably be the first link that pops up. It's just the CDC's website. There's a ton of information there for you. Okay, so these are some facility layout considerations. We should be using physical barriers to protect staff who have interactions with clients with unknown infection status. Oh, thanks, Kristen. Kristen just posted that link in the chat. Cool. So maybe that means installing a sneeze guard at the check-in desk or placing an additional table between the staff and clients to increase that distance to 6 feet. Anywhere that people are going to congregate, so like meal service areas, sleeping areas, we need to try and keep that barrier of 6 feet if possible. So like space out the seats, space out your beds. If you can, place your beds so that the clients sleep head to toe. And then if you have clients with mild respiratory symptoms consistent with COVID-19, we need to prioritize these clients for individual rooms. If that's not available, we need to consider using a large, well-ventilated room. Maybe put up a temporary barrier, like maybe a curtain, between the beds. And we really need to try and designate a separate bathroom for these clients. And if areas where these clients can stay are not available in the facility, then we need to facilitate transferring them to a quarantine site. And then for clients who have confirmed COVID-19 cases, regardless of their symptoms, we need to be doing everything that I just said. So these people definitely need to be in their own room. However, if you have more than one person that has tested positive for COVID-19, those clients can stay in the same area since they're both definitely positive. They absolutely would need their own separate bathroom from other clients. Okay. A few more facility procedure considerations. So we need to plan to maintain regular operations to the extent possible, and we need to limit people who are not client, staff, or volunteers from coming to our shelters. We are not going to require a negative test for entry to a homeless service site unless otherwise directed by local or state health authorities. And then at the bottom in bold there, you'll see all clients should wear cloth face coverings anytime they are not in their room or on their bed or mat in a shared sleeping area. And then one really important thing to note is that we should not be putting cloth face coverings on people who are unable to take them off themselves. So young children under the age of 2, anyone who has trouble breathing, is unconscious, or incapacitated. So we need to regularly assess our clients and staff for symptoms. And that tool that Victoria is going to talk about in a minute in HMIS is going to help you with that. In bold there, you'll see that we need to use standard facility procedures to determine whether a client needs immediate medical attention. So these are those emergency signs. So these are the really bad symptoms of COVID-19. If any of your clients have any of these symptoms, they need to go to the emergency room immediately. Those symptoms include trouble breathing, persistent pain or pressure in the chest, new confusion or inability to arouse, and bluish lips or face. So again, if any of your clients experience any of these symptoms, it is time to go to the emergency room immediately. I wanted to talk a little bit about PPE. Those cloth face coverings are not technically PPE. This is something, like we said, that's small that we can all be doing to help keep ourselves safe. But if you are going to be coming in contact with someone who is COVID-19 positive, you need to have actual PPE, which means, a ventilator, something covering your eyes, gloves, actual PPE, not just a personal face covering. But on that note, those cloth face coverings that we should all be wearing should be laundered regularly, and the staff that's involved in laundering those client face coverings should do the following. So they need to be collected in a sealable container, like maybe a trash bag. The staff who is collecting all of them should be wearing disposable gloves and a face mask. Use of a disposable gown is also recommended if possible. And then make sure that you remove your gloves properly so that you're not potentially exposing yourself by taking those off. And as we already talked about, cleaning and disinfecting regularly touched surfaces at least daily and shared objects between use. And again, I know I'm kind of going quickly through this, but if you'd like more information on this, please click that link that Kristen put in the chat. So screening clients at a shelter, again, our tool that we've built is really going to help you with this. But if someone screens positive for symptoms, they should be directed to where they can stay either within the shelter or at another location according to a pre-designated plan developed with the local COC, your public health department, and your community leadership. So we need to be determining if the client has a fever, asking them if they have any of the other symptoms, which our tool is going to walk you through, providing a face mask for the client to wear, notifying management and appropriate healthcare providers as available, and then direct them to an isolation room, if available, or an available space in the area designated for those symptomatic people. We need to let the client know that if their symptoms get worse, they need to let someone know immediately. They should not leave their room or the symptomatic area except to use the bathroom, which hopefully is their separate bathroom. And if they leave their room, they must wear a mask. And this is just like a little short slide on how to correctly take someone's temperature using one of those temporal thermometers. I hope that you have access to one of these. If not, maybe we can figure out how to find you one, because this would be really helpful instead of having to use an oral thermometer where you'd have to put it in your client's mouth. So just make sure you're whatever kind of thermometer you're using, just make sure you're cleaning it really well between each client. And just to clarify, anyone with a temperature over 100.4 degrees is considered having a fever. All right, some staff considerations. There's a lot here, but basically the things that have changed are in bold, and on the staff considerations, the main thing that's changed from a month ago is just that everyone needs to be wearing that cloth face covering, which I know I have said multiple times now. So yeah, if anyone has any questions about any of this, please let us know. And the street outreach staff guidelines from the CDC actually hasn't changed at all from last month. So basically, same thing as before. You just want to keep that distance of 6 feet. You want to explain to your client that you're taking additional precautions to protect yourself from COVID-19. So this goes for emergency shelter staff too and volunteers. We really just want to educate everyone on what's going on, passing this information on to them, letting them know how they can be safe and how they can make others safe. And then if at any point you do not feel that you're able to protect yourself or your client from the spread of COVID-19, you should discontinue the interaction with the client and notify your supervisor. So that could be the client declining to wear a mask, or if you're unable to maintain that distance of 6 feet. And that about does it for my part of the presentation. The last thing I wanted to just say is that I know that this is a lot to cover really quickly, and I know that this might sound overwhelming because there's a lot of work to be done, but we all just need to do what we can to get through this. The quicker that we can adjust and take these precautions, the quicker this will hopefully be over. And if you have any questions, issues, concerns, or needs about how to implement any of this in your shelter or your street outreach program, you should contact Molly or Sophia. They are kind of the COC lead agency COVID-19 response task force. It's a long title. So email them, let them know what the issue is and what the question is, and I'm sure that they can help you. Okay, I'm now going to pass things over to Victoria.
Thanks, Lindsay. Just want to give a shout out to Jane Portis. Yes, the PowerPoint presentation will be made available. Once we are done here, we will circle back to the lobby where you can download it, and I believe we'll also be sending out an email as well that will have that information. So my portion here, I want to talk about the COVID-19 screening tool that we have in HMIS. So if you've been doing data entry for the past few weeks, then you've seen the new screening tool for COVID-19, and you may have noticed that there have been some very recent changes to the tool. One thing that was not included in the original screening tool was a script that case managers could use with participants to give context into why the questions were being asked. We were making some really big assumptions that the participants knew or understood what COVID-19 was, and that might not be the case for all participants, or they might have questions. So this is not necessarily a script that you have to go through with the same participant over and over again. You know, you might start with a probing question to see if the client knows about COVID-19 or if they have any additional questions. This script will be included in HMIS as well as on the paper version of the assessment. And I know that these may seem like basic questions and concepts to cover, but I do think that it's worth making sure that you cover every single base with your clients, with your participants, because this virus can really have, it has such a big and harmful impact. So I'm not going to read this script here, but I would like for you to get familiar with it. All right, let's talk about some of the new questions that have been added. So the CDC has recently updated the symptoms associated with COVID-19. Before, we were asking questions just about cough, fever, and shortness of breath. Now that we know more about this virus, the list of symptoms is longer to include chills, muscle pain, headaches, sore throat, and loss of taste or smell. And when I say that these questions have been included, I mean that we're basically asking participants, are you experiencing chills? Are you experiencing any new headaches? Do you have a sore throat? That kind of thing. Another change is that we have shifted from drop-down menus on these questions to radio buttons, and we're going to see in the demo here in a bit exactly what that looks like. They're basically just dots. And that does make the assessment stretch out a bit. It makes it longer, but it should actually save more time so that y'all aren't having to click the drop-down menu and then click on the client's response. So if you're doing multiple of these assessments, if you're doing dozens of these screenings a day, those few seconds will add up and should hopefully save you some time as you're going through this screening tool. These changes went into effect in the live sites on April 27th, and I do want to address the fact that some of these changes seem to be coming in really hot and fast and out of nowhere, and I want to assure you that we are making these adjustments almost as quickly as the CDC is putting them out, right? The situation with COVID-19 is rapidly evolving, and we want to make sure that we are staying on top of it as best as possible. But the flip side of that is that you're likely going to see changes and updates to this screening tool with almost little to no notice before the fact. So I just wanted to kind of give y'all a heads up with that. I know that sometimes changes and updates can throw things a little out of whack, but we're not doing it just to do it. We're really basing our tool off of what the CDC has put out. Okay. I am going to take some time just to do a very, very brief demo of the tool itself. Okay, so I am currently in the intake right now, and this is one of the places, one out of two places, that the screening tool appears. So again, this is only going to be seen for emergency shelter and street outreach projects. At the top here, we have a list of symptoms for COVID-19, flu, and allergies, just so you can compare and contrast what the symptoms are for each one. We also have the script readily available for you to read for the client at the top of the assessment. I'm going to scroll down a bit, and we're going to see the radio buttons. So before we had some drop-down menus where you would click the drop-down menu and then you would see the responses. And so that would take like an extra click or two to actually get the data into the system. Here you're just clicking with what the client responds. Now, This appears in the intake after the universal data assessment. So after you answer questions about, where was the client the night before they entered your program? Do they have a disabling condition? Do they have health insurance, yes or no? Then you will be immediately pushed to this screening tool page. And then once you save, you'll move on to barriers and domestic violence and what have you. This is not the only place where the screening tool is available. It is also available outside of the workflow. So if you look at the client's menu on the left-hand side and you open up the assessments menu, you should see an option that says COVID-19 Screening Assessment. So I'm going to click on that, and it will bring you to a page that will have the screening assessments that the client has completed. They may have more than one. I'm in the training site, and so this particular client has multiple assessments done. There are two options here. We have Add New COVID-19 Screening Assessment, and then Add New At Risk of Homelessness Assessment. This button right here is only for homelessness prevention and rapid rehousing projects. So you would not even see this assessment during the intake. We're not asking street outreach and emergency shelter clients to go through this. If you want to add a new screening assessment to a client outside of the workflow, this is where you would go to do that. You would just click on the Add New COVID-19 Screening Assessment, and it'll take you exactly to that same page that we saw in the intake. And you might be asking, well, what is the reasoning behind having it in both the intake and outside of the intake? And just to clarify, we don't have this at exit. It's really just at entry and then outside of the workflow. Expert guidance is saying that you should actually be asking these types of questions, these screening questions, with every interaction that you're having with the client. And I know that that is difficult, if not impossible, for some agencies just because of capacity issues. We understand that you have a lot on your plate right now, and so that is the ideal. And whatever you can do to get to or however close you can get to that, even if that's just completing it at intake, if that's as much as you can do, we're good with that. We do not have any expectation of back data entry. So if you had any clients that were enrolled in your project before we put this screening tool into the system, I believe that was about 3 weeks ago, we do not have the expectation that you go back and do a screening with those clients backdated or anything like that. I will say, though, that if you are going through an intake with a client and they're answering yes to a lot of these questions, it may be worth, if you have the capacity, to ask some probing questions and figure out, has this client had any interaction with any other client at your agency? And if so, it would likely be worth doing a screening with those clients as well, just to see if there's any overlap in symptoms. Again, it really just comes down to capacity and what you are able to do. If you are able to do it, it is available here outside of the workflow for you. All right, so we've already talked a little bit about why the screening tool is important. This is taken directly from the CDC. So to limit the spread of COVID-19, it's important to promptly identify, separate, and ensure that ill participants are wearing a cloth face covering. Recent studies indicate that people who are infected but do not have symptoms likely also play a role in the spread of COVID-19. For this reason, measures should be implemented for everyone in the facility, regardless of symptoms. And it's also important to maintain a safe distance, at least 6 feet, between both participants and staff as much as possible. So that identification piece of clients that are symptomatic is especially important here, as is getting as many clients as possible to wear face masks or coverings like Lindsay has mentioned. So Like I said, and I keep coming back to this, right? Obviously, you're only going to be able to do so much as capacity allows, but the more that you can do, the more clients you can identify who are symptomatic, the better, especially since it's sounding like a decent chunk of people infected with COVID-19 are actually asymptomatic. So just to give you a scenario, imagine if you screen everyone who comes through your shelter and very few of them display symptoms, but then when you compare that HMIS screening data with county COVID data and you see that actually your county has quite a few cases, that could be a cue for you to take more precautions to protect your clients and your staff. Other things to think about, right? Are there local ordinances in place that you know your agency has to follow? Is your agency already incorporating CDC guidance, or is your agency taking other measures? Do you know where to find up-to-date information about COVID-19 in general and case counts for your county and surrounding areas specifically? All right, so again, just to continue on this topic of why a screening tool is important, you know, the CDC is at least in healthcare, they're asking to screen patients before they enter the facility because that reduces exposure for other participants and staff, helps prevent and spread the disease within the facility, and helps ensure personal protective equipment is used effectively. Obviously, that's not really you know, screening before entering the facility is not always available for homeless shelters, right? Homeless services are often provided in congregate settings, which could facilitate the spread of infection. Because many people who are homeless are older adults or have underlying medical conditions, they may also be at higher risk for severe disease. You know, like I said, it may not be possible to do that screening piece before they enter the shelter, but at the very least, we can just complete that screening piece in general. Okay, so why are we making it required? I think this is the first time that I've mentioned in my whole speaking portion right now that we are indeed making it required. And one of the big reasons is because people are not filling it out. And again, I recognize that this may be an issue with capacity and we don't have expectation of back data entry, but this is a very important bit of data for us to collect. Especially because there is a lag time in testing and sparse testing availability in the state of Texas. So right now, Texas COVID-19 testing is at about 26,900 positive cases as of today, as of April 29th, 2020. I pulled that number this morning, and so we have likely you know, breached 27,000 cases. But Texas in general is actually not that great in terms of testing capacity. I believe we are like in the bottom 5 states in regards to, you know, the size of our population and how much we are testing people. And I personally have doubts that, you know, our homeless clients are going to have the resources available to actually get tested versus someone who has more resources available at their disposal. So we really need to have something to be able to fill in that gap to somehow help communities and agencies make better informed decisions. And I'm going to pass this off to Marissa, who has been working on a data dashboard looking at the data that you guys have been entering for that screening tool.
Hello, everyone. Thanks, Victoria. I'm just going to go over real quickly about where to find our balance of state dashboard, what it's showing us, and how the data you input into the COVID-19 screening tool directly affects this map. So you can find our COVID-19 data dashboard by going to our website, which is THN.org, hovering over the tab titled Texas Balance of State Continuum of Care, going down to the Homeless Management Information System, and finally selecting the tab titled HMIS Training and Resources. Once you are on our HMIS Training and Resources page, you can scroll down to the bolded header labeled COVID-19 Resources, and it will be that first link titled Texas Balance of State COVID-19 Data Dashboard. And that link will take you directly to the dashboard in Tableau Public. So here is what the dashboard looks like currently. It tells you the total number of clients who have been screened using the COVID-19 screening tool in HMIS and the total number of clients with potential COVID-19 symptoms. It's also important to remember when looking at this dashboard that symptoms present does not mean COVID-19 positive, so please don't associate the two terms together. The main point of this dashboard is to give you an inside look to see if whether or not there are any hot spots where clients are showing symptoms, and if that county also has a high number of recorded positive cases, as shown by the Texas Department of State and Health Services, or DSH's map to the right. And it's going to be that small map in the right-hand corner with the little purple highlighted sections. To get information on each county, you can use the drop-down menu to search for one or multiple counties at a time, or you can simply hover or click on each individual county on the map below, and a description box will appear with data relevant to that county. Please note that the drop-down menu includes all 254 counties in Texas, regardless if they have any data. So don't be worried if you select a county and no data appears below. It just means that we don't have any information for that county in HMIS. The table to the left of the dashboard gives you a quick visualization of each county that has currently screened clients, as well as the number of clients screened. To help you navigate that table, you can use the legend located right below it. If you click on the symptoms present in that legend box, it will then highlight where those clients who have symptoms present are located and give you the count of how many there are. So here we can see that Bell County has 1 client, Hidalgo County has 1 client, and Jefferson County has 3 clients who had any type of symptom or symptoms present when they were screened. You can also do vice versa and click on the no symptoms in the legends box, and it will highlight where and how many clients have no symptoms by county. So now we can see, though Jefferson County had 3 clients with symptoms, they also have 40 clients without symptoms. So the more you use the screening tool in HMIS, the more robust data we will have on your county. This could be really beneficial if we start to see some areas that have more clients screened with symptoms than without. You can also find a separate dashboard that is based solely on the DSH's COVID-19 data. And you can find this dashboard by clicking on the tab at the top labeled DSH's Data. I added this dashboard to use as a reference to get a more well-rounded view on what the current state of your county looks like according to the Texas Department of State and Health Services. While our HMIS data dashboard does not show any COVID-19 positive data, this dashboard does. It gives you the total number of positive cases in Texas and the total number of COVID-19 related fatalities. You can also use the drop-down menu located at the top to sort by positive cases or fatalities. This dashboard is updated daily with the most recent data put out by the Department of State and Health Services. If you have any questions about this data or how the dashboard works, please contact us at hmis@thn.org. Now I'm going to go ahead and pass it on to Antonio to go over a few polls with y'all.
Hi everyone. So I'm going to take a little pause now and quickly poll everyone on resources and steps that are being taken to protect staff and clients. So as Lindsay and Victoria have mentioned, there are a lot of reasons why we should be taking steps to ensure a safer working environment, especially for our staff at emergency shelters and street outreach programs, because in those programs, you'll already know that there's a lot of face-to-face contact, and we want to make sure everyone is prepared and has the right resources to continue on doing business safely. So the first poll that I'm going to pop on the screen shortly is to see whether or not everyone on your staff has access to masks and gloves. So this one is a quick yes or no answer, and we're really just trying to get an idea of where people may need more help or resources, or maybe we can step in somewhere. So, as you know, masks and gloves are a great way to prevent staff from contracting COVID-19. They do prevent particulates from entering the airways, and the gloves help from anything sticking to your hands and then later possibly getting brushed up into your airways somehow. So, that being said, masks and gloves, however, are not a replacement for social distancing. So as you know, CDC has recommended that in order to effectively socially distance, people should be placed at least 6 feet apart in order to prevent the spread of the virus. In the case of bed placements, like in emergency shelters, as Lindsay has mentioned, beds and cots should be placed head to toe, and reception areas should have sneeze guards installed. Okay, so what I'll be placing on the screen now is another poll talking about social distancing and how, this is being implemented, or maybe how it's not being implemented, right? I think it's just a good baseline. Okay, so I'll leave this one on for a little bit longer. Actually, what I'll do is I'll open up the last poll as well, and then I'll let y'all fill it in. So for the final question, or for the final poll, I want to really pose this one to HMIS admins. If a client is suspected of having COVID, what plans are in place currently to isolate the client? Okay, so the reality is that if a COVID positive client is found at your shelter and there is no isolation process in place, the virus could easily spread through our already vulnerable community. From what I've read from other communities, some organizations are having to get a bit creative in isolating clients, since space has already been pretty tight since the beginning. Some organizations are using hotel vouchers or even repurposing conference rooms as quarantine areas. So I'll go ahead now and place that last poll on here. There we are. So in today's webinar, Lindsay and Victoria covered a lot of ways of preventing the spread. If you have any questions after this, or if these poll questions sort of brought up other questions in your mind, feel free to reach out to us, especially if you're reaching out on behalf of an organization and you feel like y'all are really lacking resources, or maybe you feel like your staff could use a little more specialized training in how to safely go on practicing our business during this pandemic. Feel free to reach out to us. I think, you can reach out to HMIS at THN.org.
All right, guys, thank you for participating in those polls. I am going to move on to the next section and talk about the release of information and obtaining client consent very briefly. However, just before I do that, I do want to touch back a little bit on the screening tool. Even though we're making it required and you will no longer be able to skip past it in the workflow after today, the client still does have the ability to refuse to answer the questions. We just want to ensure that the questions are being asked. There is also a question in the chat regarding reports. How do we get those numbers? Since it is a custom assessment, there is nothing in Client Track that reports on COVID-19 data. So if you need something specific, you will likely have to reach out to us at HMIS@THN.org. And then depending on what kind of data you're asking for or what kind of numbers you're interested in, we may or may not be able to get that to you on a regular basis depending on how our capacity looks. But if you are needing something beyond what Marissa's dashboard has, please don't hesitate to reach out for us and we'll see what we can do for you. All right. So, you may find that it's more difficult to collect a release of information with clients while trying to maintain social distance measures, and you are likely not interacting with clients as you normally would. Our current ROI allows for verbal consent, meaning if you read the client the release of information aloud, whether over the phone or potentially at a distance, and they verbally give you the okay to move forward with data sharing, then you're good to go. There is a specific space on the ROI document where you would sign in the client's stead, and I do recommend that you go to our website and download the release of information, because we have recently updated the ROI so that it's clearer and easier to understand in regards to verbal consent. Now, we do have the expectation that eventually a paper ROI will be filled out for clients once it is safe to do so. And typically this would be when the client next presents at the agency for services, but again, these are very strange in different times at the moment. So, even with the client physically present at the agency, it still might not be safe to get the ROI from them. So we understand that. We also want users to read the privacy notice to clients, and that is also on our website, while going over the ROI. We will also have a short video available on our YouTube channel that covers the ROI, verbal consent, and COVID-19 specific scenarios in which you might make a data disclosure, and we're going to cover those specific scenarios here in a bit. So I do want to cover what are uses and disclosures. So uses are internal activities for which organizations interact with participant personally identifying information, or PII. Disclosures of PII occur when organizations share that PII with an external entity. So uses are for internal activities, disclosures are for external activities. And now the sorry, I lost my spot. Okay, so even if the client indicates that they do not want to share their information, there's a spot on the release of information where the client can indicate that no, they don't want their information shared. There are actually some specific situations in which a client's data may be shared without their consent. And I do want to stress that the authority to share that data is not unlimited. There's really two specific areas for disclosures. There is a disclosure required by law, and then there are disclosures to avert a serious threat to health or safety. So you are interacting with, providing services for, and helping a population that is at a higher risk of being infected or impacted by COVID-19. And so that we're going to talk a little bit about how that ties into serious threats to health or safety. So a provider may share a participant's COVID-19 status under applicable law and standards of ethical conduct if the provider believes in good faith that the disclosure is necessary to prevent or lessen a serious and imminent threat to health or safety of an individual or the public, and the information is shared with a person reasonably able to prevent or lessen the threat. So note that the threat to health or safety can be a threat to any individual or to the public in general. So under current emergency circumstances, disclosing COVID-19 status to anyone offering services to a client meets this standard. Disclosing information about other individuals possibly exposed to COVID-19 is also permissible under this authority to either the exposed individuals, to anyone who can offer healthcare, protection, or assistance to an exposed individual, or to anyone who can lessen the threat of COVID-19 to themselves, to others, or to the public. And this is not something that we just made up out of thin air. This is guidance that is coming directly from HUD. Let's quickly cover, because I know that we are running up on our time here, let's quickly cover some COVID-19 specific data disclosure examples. So scenario 1 would be disclosing information about a participant infected with or suspected of being infected with COVID-19 to a public health authority. Scenario 2 would be disclosing information to a healthcare provider. Scenario 3 would be disclosing information to a shelter or other homeless provider when referring that participant or another participant. Scenario 4 would be disclosing information to a transportation provider, emergency worker, or first responder when referring that participant or another participant. And scenario 5 would be disclosing information to a third-party quarantine or isolation facility when referring that participant or another participant. Before you make a data disclosure, there are some steps or considerations that you will want to take first. So the first thing that you want to consider is, does the disclosure request fit with one of the scenarios outlined in the previous section that we just covered? Second, you want to consider if there are any local laws in place that require disclosures of PII. Third, you want to ask yourself, do you believe in good faith that the use and disclosure of a participant's PII will avert a serious threat to health or safety? Next, you want to consider what the request is actually asking. If the public health authority or organization does not require PII, but instead de-identified data will work, such as a client ID or just overall aggregate numbers, then you're going to want to send that de-identified data. If the public health authority is asking about a single participant, do not send them an entire list of your participants. Just send them, the data that they're asking for, and that's it. Lastly, you want to ensure that PII is protected. Send data in a password-locked spreadsheet. Microsoft has a really good video of how to do that in Excel, so I'm not going to cover that or do a demo of that, but there are tutorials that you can find online. If you do not believe that your agency has the capacity to answer a disclosure request from a local public health authority or other interested organization, please do not hesitate to send the request to the Texas Balance of State HMIS team at hmis@thn.org. We will need a copy of the disclosure request, and this can be sent to us through email, as well as the HMIS client IDs of the participants that the request is for. And I also just want to reiterate that the screening tool does not ask about the client's actual COVID-19 status. We're only screening for symptoms. We are not collecting any information about has the client been tested and what were the results of that test, partially because we had doubts that a majority of our clients would even be tested. We had doubts about timeliness of the data. A client might potentially get tested and then not know the answer to that test a week out, right? So timeliness was a big factor, and then just client privacy was another factor. So if someone asks you if that data is being collected in HMIS, it is not. We are only collecting data about symptoms. That's it for my piece. If you have any questions, please do not hesitate to send them in the chat box or send them via email or give us a call. We really appreciate you guys coming in. I know that, things are crazy now and you've got a lot on your plate, so I really appreciate you taking the time out of your busy schedule to join us today.